Welcome to Good Chat, the podcast from BC Adventure Smart, where we share stories, insights, and tips to help you enjoy the outdoors safely. We talk all things outdoor recreation and adventure, while keeping safety at the heart of every conversation. Our goal is simple: to lessen the impact on search and rescue and help grow a stronger safety culture in BC. Whether you're hiking, skiing, paddling, or just curious about BC's backcountry, this is the place for real stories and practical advice to keep you prepared and confident outdoors. Let's dive in.
Welcome to Good Chat from BC Adventure Smart, where stories and safety meet. Today we're exploring how the great outdoors can be more than a place to play. It can be a prescription for better health. We're talking about Healthy by Nature, PaRx Prescription, a groundbreaking initiative that helps healthcare professionals connect patients to nature as part of their wellness journey. We'll look at how time outside benefits both the body and the mind, how healthcare providers are using PaRx in practice, and how anyone can take a small, meaningful step forward toward healthy activities outside. BC Adventure Smart works to inspire safer adventures by building awareness among outdoor enthusiasts, reducing the impacts on search and rescue, while adding to the safety culture in British Columbia. I'm Sandra Riches, the Executive Director for BC Adventure Smart, a program created by the BC Search and Rescue Association. Today's episode, Prescription, Go Outside, How Nature Heals Us. We're excited to welcome Laura Hergott, who's here to share how the PaRx program, an initiative of the BC PaRx Foundation, is empowering healthcare professionals and everyday adventurers to make time in nature simple, fun, and effective. Let's dive in. Hi, Laura. How are you doing today?
Hi, Sandra. Great.
Really glad to have you here and to talk about all of this. It's all new. It's exciting. It's moving forward really fast. Maybe you can tell us a little bit about how your background brought you to this and what led you to this work with the PaRx program.
I first got involved with PaRx about 3 years ago now, almost 4. I was living in downtown Toronto and found myself seeking out nature every chance that I could get. I'd spend a lot of my weekends in the Collingwood area rock climbing or camping in one of Ontario's provincial parks, Algonquin a lot of the time. And I found these experiences hugely beneficial to my mental health. And I could really feel the difference when it had been a while since my last time outside. So I decided to move to British Columbia, where there's a real culture of spending time outside, and getting into remote areas is a lot more accessible. And it was after I moved to Vancouver that I learned about the PaRx program. Intuitively, I'd incorporated more nature into my life for my health, and it was really validating to read about all the research that actually backs it. I knew that I just had to get involved to help spread the message of getting outside for health. It had made such a big difference in my life and knew it could make a real difference in other people's lives too.
What inspired PaRx initially, and how did it grow to a national movement?
It's important to start by recognizing that traditional Indigenous ways of knowing have recognized the deep interconnection between human and ecosystem health since time immemorial. But it's taken Western science a while to catch up, but it is. There are now hundreds, if not thousands, of studies that show that spending time in nature has a wide variety of positive health outcomes. So PaRx is based on this growing body of evidence, and it was also launched at a really critical time when we're dealing with a mental health crisis, but also the issues of climate change and biodiversity loss. To make sure we have a healthy planet for all of us, for the future, for future generations, people need to recognize the importance of a healthy environment and be motivated to take action to protect it. It's been proven that connecting people to nature promotes environmental behaviors, and that nature prescriptions are a really effective way of doing that. So it was launched at this really critical time and snowballed quickly into a national movement because it just made so much sense as a nature-based solutions. And it was designed in such a way that makes prescribing nature easy, fun, and effective for prescribers and patients.
Heading outdoors, plan ahead, be prepared, and stay safe. From checking the weather and telling someone your plans to carrying the essentials, small steps make a big difference. Together, we can lessen the need for search and rescue and build a stronger safety culture in BC. Your safety is your responsibility. Check out the Adventure Smart Trip Plan app at adventuresmart.ca.
I know a lot has changed over the years of our program here at BC Adventure Smart, which is 2 decades, 20 years. We've seen changes and trends alter, shift, build, grow, if it's an activity or even just interest in direction that people take. Why do you think the connection between health and nature resonates so deeply right now?
It's a really good thing to think about. And I think 2 things come to mind. The first was what happened in 2020. And this is when PaRx actually launched as a program starting in British Columbia. As we all know, 2020 was an unprecedented time. And some thought that we'd have trouble getting buy-in from healthcare providers because the healthcare system was already being stretched so thin. But there was this really interesting thing happening, which was that people were starting to really recognize the power of getting outside for health more and more. Going for your daily mental health walk became a socialized norm, and people really felt that difference between isolating at home all day versus going outside or going to a park. So what seemed like a challenge at first really turned into an opportunity. And the second piece that really comes to mind is what's happening with technology these days. It's becoming a bigger and bigger part of our daily lives, and people are outside less and less. People wonder, why am I feeling so anxious, more tired? Why is my attention span getting shorter? And then when they step outside, they get unplugged, their shoulders drop, they can breathe deeper and just feel more relaxed. And so I think this program that connects people to nature is really coming at the perfect time.
I fully agree. And I know here at the BC Search and Rescue Association, we use data-driven stats to steer our outdoor education. It allows us to look back at where search and rescue is happening, who's calling for help the most, what regions, what user groups. It really helps us steer direction. What does the research tell us about the health benefits of spending time in nature?
It's such a great question. And how long do we have? Because
Not long enough, obviously.
Not long enough. I could probably go on for a while about this. Essentially, the research tells us that spending time in nature has a wide variety of positive health benefits for both mental and physical health. It fights depression. It reduces the risk of heart disease and stroke. It improves attention, lowers the risk of asthma and allergies, and helps you live longer. I'll share just one of my favorite things that I like to share. So trees produce this volatile organic compound called phytoncides. And it helps trees ward off pests and insects. And it's been shown that when humans breathe in this smell, it's basically the smell of trees or this volatile organic compound, that our immune system is also significantly boosted. And that effect lasts up to several days after an exposure. And there was a study that they did on phytoncides, and the people in the study didn't connect to nature in any other way. It was just the smell of trees being diffused into hotel rooms. And those folks that had the phytoncides, the smell of trees, had that boosted immune system compared to the folks who didn't have it diffused into their hotel rooms. So
wow,
even on the
really?
molecular level, trees, forests, nature is healthy for us.
That's amazing. So we could get diffusers that smell like trees and put them in our homes and have
We
that there.
could.
It sounds like, right? Like you just described one of many, no doubt, examples of how that can benefit us. We talk about forest bathing or in general, people talk about this or that, or we go to the forest not knowing even not one little bit of what you just described to us, but we also know it makes us feel good. It makes us feel good mentally, physically, and we know it's a great space to be in. How do healthcare professionals use PaRx as a practical tool in their work?
So for those new to nature prescribing, we often encourage them to prescribe nature when they're doing other lifestyle counseling. So anytime someone is making a recommendation about nutrition, exercise, or good sleep, to include nature time as a fourth recommendation. To make it easier to introduce and talk about, we have some patient handouts that describe some of the health benefits of nature and tips for getting outside. And when writing prescriptions, we encourage prescribers to use motivational interviewing. Find out what the patient already likes to do outside, or if there's something they've always wanted to try. What does their day-to-day routine look like, and how could they easily incorporate more nature into it? What's holding them back? And what can we try to do to reduce those barriers? Those are the types of tips we provide to prescribers.
Great tips. I'm curious about time outside. Can even just little short bits of time outside make a measurable difference in our well-being?
Absolutely. We actually recommend a starting dose, quote unquote dose of 20 minutes. This is based on a study that found that the 20 to 30 minute mark is when someone's cortisol, which is a stress hormone, drops the most efficiently. But there are other studies that show even 5 minutes can have a positive effect. And importantly, when we talk about these 20 minutes, we don't provide any strict guidelines about what these 20 minutes look like. It could be 20-minute stroll in the park. It could be sitting by a pond. It could be eating lunch outside. Whatever brings a patient a meaningful connection with nature is what's going to work best for them as a prescription.
And that would be different for each of us, right? Some of us 5, 10, 15, 20 minutes on a lunch break could be that infusion of that injection. And others spend hours, right? And even weekends out there. And it can really make it different for all of us, I'm guessing. What about barriers? Do you think barriers like either access to nature, time, mobility, does any of that have a factor?
Yeah. So definitely one of the biggest barriers we hear people talk about is time, which is tough because obviously we can't give people more time, but we can give them tricks. So we like to talk about what we call green tweaks. And these are simply swapping indoor activities for outdoor ones. Just like we said, eating lunch outside instead of inside. That's a green tweak. And it's something that you can just easily incorporate into your daily schedule. We do also partner with nature-based organizations and mobility organizations to try and reduce some of those financial barriers to getting outside. We partner with national parks, conservation areas, and botanical gardens to provide people with discounted or free access. And we also provide free minutes for car share or bike share programs to make it easier to get there. That's all really great. But I think the other thing we try and do is to rebrand what we define as nature. Going to a city park is just as healthy as going to a remote national or provincial park. So trying to combat that misconception that nature time only counts when you're in a protected space or when you're engaging in forest therapy. There have been studies that show even looking at pictures of nature, being around indoor plants and listening to sounds of nature can have positive effects. So that can also be really useful when someone's talking about not having enough time, because I want to say almost anyone can add those little tweaks to their life to have more nature in their day-to-day.
You're listening to Good Chat Podcast from BC Adventure Smart. I'm Sandra Riches, Executive Director. Today's episode, Prescription, Go Outside, How Nature Heals Us, with special guest, Laura Hergott. What does a nature prescription actually look like in practice?
It's literally a piece of paper that's signed by your healthcare provider, and a blank one is basically a big blank space in the middle. And with your healthcare provider, you come up with a specific plan about how you can spend more time in nature. We often recommend talking about your day-to-day routine and making those little switches, those little tweaks to spend more time in nature. Can you cycle to work? Can you take a walking meeting at work instead of meeting inside? Can you orient your work desk towards a window that looks out on green space instead of a wall? All of those pieces add up. And we recommend a few other tips. For example, just making it specific. You're a lot more likely to do something when you've committed to a specific time, as well as if you're going to go with someone else. There's a little bit of social pressure that can play a role here. If you're going to meet a friend at the park, you're more likely to do it than if you just promise to go yourself.
I love those ideas of hike and meet and walk, lunch and learns, whatever they are, outside. I remember going to a meeting once, and it was in Whistler, and they said, let's just walk around the village. I'm like, sure, no problem. That sounds great. And this was part of our meeting. It was time for both of us to get outside, and we accomplished the same thing we would have if we would have sat inside. Yet we were walking around, getting some fresh air, some vitamin D, and it was a great idea. A great idea. I've done it on other meetings as well. It's really quite productive, I think.
Think about in schools as well. Outdoor learning can be so effective Even the kids know it. They know that they're better able to pay attention, that they are calmer, more relaxed outside than they are inside.
I'm thinking about the healthcare providers here for a minute. How have healthcare providers embraced this program? Because this is something new for them, right?
Mhm. Yes and no. A lot of the healthcare providers that we talk to or we introduce PaRx to, they say, I've been telling my patients to get outside for years. And
Oh,
so often what we hear is a sense of relief that this is great, that this is backed up by evidence, and that it's becoming official and it's credible. So the program PaRx has been endorsed by more than 100 health organizations in Canada. This includes, for example, the Canadian Medical Association, the largest physicians association in the country. And they have said to their members, they've even written it in policy, that nature prescribing should be an important part of your practice. And every practicing physician should include it. And every medical learner should learn about the importance of spending time in nature and nature prescribing. So we really often get a very positive response from healthcare providers.
There's no charge for search and rescue in BC. If you're lost, hurt, or in trouble outdoors, don't hesitate. Call 911 right away. The sooner you call, the sooner trained volunteers can get to you safely. In an emergency, call 911, stay put, and wait until help arrives.
I'm just thinking here too of patients for a minute. I wonder, or maybe you have some data to share, do patients sometimes feel like this might be an onerous task? Like, oh my goodness, my doctor just said I have to go for a hike or even a walk on my lunch. Not everyone's adventurous. Not everyone loves to be outside, to be honest.
Mhm.
And now they're being directed to that space, outdoor space. And I'm wondering if there's any pushback maybe from patients. Do you have any data on that or information?
Yeah, well, I think that's really where the writing the prescription hand in hand with the doctor is important. It's different than a traditional prescription for medication, where a doctor says, you're going to be taking this medication this many times a day, and it's you're given it and its instructions. A nature prescription is really almost co-designed with the patient and the prescriber so that it only includes activities that the patient is interested in doing. If they say,
Mm.
would you like to go for a hike? And the patient says, I am absolutely not interested. I do not like hiking. That's okay. You do not have to go hiking to get the health benefits from nature. There are other ways to incorporate nature into your life. So I think that's the real important difference here is that nature prescription is co-written almost with the patient in mind.
Really supportive, a really supportive environment. Yeah, those are great examples. Do you have any stories to share of someone maybe whose health was truly improved through PARX?
Oh my goodness, there are so many. We receive all sorts of testimonials from patients. I'll share one of my favorites. This is a quote from one of our patients. They said, spending time in nature has helped with my mental and physical impairments more than prescription drugs have done. Just being out in nature helps take my mind off the chronic pain I'm in and eases my anxiety and depression to manageable levels. And I really like this quote because it shows how a nature prescription can work alongside traditional clinical practice. This individual also takes prescription drugs, and they likely also have other therapy that they do for their chronic pain. And they've added nature time as a piece of their treatment plan. And it's evident in their feedback of how impactful it's been.
Really great to hear. I know we collect feedback too from subjects that have been rescued by search and rescue about their experience, about what they applied with the BC Adventure Smart best practices, and it really helps steer and it helps us all as we think about the patients as they're designing their adventure, big or small, their time outside in nature with their physician. What surprised you the most about how people respond to their nature prescriptions? What has their response been like?
Honestly, I think my surprise is how seriously people really stick to it. I think about how many times my dentist has told me to floss more. I normally floss more a few weeks following my dentist appointment, but I always get a little lazy about it. But I hear from our patients that they get their prescription, and just like the flossing analogy, they start to get outside. But then how it makes them feel, it keeps them going back for more and more. It just intuitively feels so good. And people often pick up a new hobby because of it. And then they might not be going out in nature because of their prescription anymore. And it's just because they enjoy doing it. It could be cycling, bird watching, gardening. And I think that's what can make nature prescriptions so powerful. It's a healthy habit that can just be so easily incorporated into your life. No shade to flossing, of course. Very important. We should all do that. But if there was a way to make flossing more fun, maybe I would do it more.
I was thinking as well about tips. We give a lot of tips and advice and resources here at BC Adventure Smart, and I'm thinking about some of the examples you gave that some patients might pick up a new activity. And it might be mountain biking, it might be hiking. And I know that we're here to provide patients as well with easy resources so that they can have a safe adventure outdoors. So if anyone out there gets a prescription for PaRx and wants to know more about outdoor safety, come to us. We can definitely help you. Do you have a top 3 tips for someone looking to add more nature into their week? What would you advise them to do?
I think the first would be to involve others. When you're making your prescription or you're making a plan, to involve your family, your friends, your colleagues, you're more likely to stick to the plan when it involves someone else. The second tip would be to pick a specific time, to decide to go on a hike, for example, Tuesday morning or Saturday afternoon. Write it into your calendar, put an alarm on your phone. You're also more likely to stick to it when it's really scheduled in. And I think the third tip would be to think about when you need it the most. So it's easy to think about going for a hike on the weekend, for example, but I'm probably already feeling pretty good on the weekend. And when I'm feeling my most anxious or my most stressed is probably in the middle of the week during the workday. So how can I add a little more nature to my workday to get those health benefits right then and there? And maybe that's eating lunch outside, or it's orienting my desk toward a window, or listening to bird sounds, or even having my computer background as a nature photo. That's how you can really incorporate it into the day-to-day.
When you speak about all those things, it just makes me think of balance, and that you can balance that out, hopefully, with those little injections of nature somehow, some way. How can people find out if their healthcare provider participates in PaRx?
Just ask. There are more than 20,000 registered prescribers in Canada. This includes 8% of physicians, but it also includes nurses, occupational therapists, physiotherapists, social workers, and any licensed healthcare provider. If they're not registered yet, it takes about 30 seconds on our website, and it's free to do. PaRxprescriptions.ca.
Great advice, Laura. I really appreciate it. We've talked about being outside physically, literally, asking our healthcare providers, how can I start? What would this look like? I loved how you talked about how this is a plan between you as a patient and your physician. You're working on it together. And there's simple and easy ways, accessible ways to get outside that you can do on your own, but also following that prescription, and that you're saying people are sticking to it. It's something that maybe they've been encouraged to do, and it's accessible. Lunch, walks, easy time outside, just sounds and smells, even as we started this podcast, even smells. If you had to share one key piece of advice about using PaRx, what would you want people to remember?
I'd want people to remember that it's only 2 hours a week, 20 plus minutes at a time. That's the dose we recommend, and it's based on science. It's what science says is the best bang for your buck, especially at this time of year. I don't know when this podcast will be published, but when you're making your New Year's resolutions, we think about 10,000 steps a day. We think about 8 hours of sleep a night. Make sure you add 2 hours a week, 20 minutes at a time. It's like 2 episodes of Netflix. Everyone has that kind of time.
They do. We have time to watch Netflix, don't we? We have time to scroll. We have time to be outside. Oh my goodness. Laura, that's great. What a great chance to have this time to talk with you. That's it for today's Good Chat. Huge thanks to Laura for her practical tips and expert insight on the benefits of time outside, how PaRx is used in the healthcare system, and how we can all take a small step forward toward being healthy by nature.
Thanks for listening to Good Chat with BC Adventure Smart, where stories and safety come together. Remember, enjoying BC's incredible outdoors starts with being prepared. By making informed decisions and learning from experts and adventurers alike, we can lessen the need for search and rescue and build a stronger safety culture across the province. If you enjoyed this episode, please check the show notes for resources and tips. And as always, adventure smart and be prepared. And we'll see you next time on Good Chat with BC Adventure Smart.